Joining us once again from the Northeast Tennessee Regional Health Office, the medical director, Dr. David Kerschke, here with some late updates on the outbreak. Dr. Kerschke, once again, thank you so much for joining us. We appreciate it. Let's go to the most recent.
Sure, glad to be here.
Thank you. Let's go to the most recent information that we got, which was about that cluster of cases in Hawkins County. What can you tell us about what that is? What is a cluster, and what do you know about what's happening in Hawkins County tonight?
So what I can tell you is that anytime we hear about, more than one case that's related to each other, we investigate that as a cluster or an outbreak within the pandemic. So we would be working, with whatever our partner agency is, whether it's healthcare or, if it was in a jail or a nursing home, we would be working with those folks to try to determine everyone that was exposed, make sure they're quarantined. If there's any other sick people, make sure they get tested. And if, the public is involved, make sure anyone in the public that might have been exposed gets notified.
I know you're having to be very cautious to maintain privacy, and we respect that deeply. Is there anything else you can tell us, though, about that cluster? You're saying they're connected in some way, shape, or form? Is there something you can share with the public tonight as they're hearing this news?
Really just that, we will do everything we can to notify anyone that potentially could have been exposed to coronavirus through that cluster. And we'll be making notifications both in person, and I believe Ballot has also put out a press release to just let the public know about it.
That's right, and said in that news release that it included 3 of its own team members at the hospital there who worked with patients. When we hear that, it sounds like there may be more. Is it safe to assume that the cluster expands beyond just those 3 healthcare employees at the hospital?
Yeah, so unfortunately with coronavirus, healthcare workers are at high risk because they're around sick patients and, people that would be the most likely to spread it. So, healthcare workers are at high risk. And we want to do everything to protect our healthcare workers, whether it's through personal protective equipment, trying to identify patients that potentially could have it, make sure a mask is put on that person. So we are working with healthcare to try to decrease the risk among healthcare providers.
We're still tracking, we're in that phase where we're closely watching the county by county numbers and everyone in their county watching their county's numbers. This cluster, is it appearing in the numbers yet, or will we see that maybe from the Department of Health tomorrow or later in the week?
Probably most likely tomorrow. It'll appear on the state health department website.
All right. Ballot Health held a news conference today and said they saw 15 cases yesterday. Is that a spike in your opinion? And what can you say about what you're seeing in terms of caseload and the curve that we've been trying so hard to flatten? Are you seeing that flattening happen, or are you concerned about that not happening?
Yeah, so really a lot of the cases we're hearing about now, well, not a lot, but some of them, because of the lag in testing time, some of them, have occurred, the testing occurred as much as a week ago. So we do expect, and there is a backlog on testing, so we do expect to hear about more cases that were tested, 3 or more days ago. The testing we're currently doing, we're getting it back in 24 to 48 hours, but we may have some tests from several days ago all come back together. But we haven't seen a huge spike in cases, but there are some concerning things. So, whether it's a cluster or just we continue to see community spread. So we could very well see increases in the days to come.
Sounds like a critical time for data as it comes in. We did hear about, unfortunately, the region's or Ballot Health's first death today, a man in his 70s with pre-existing conditions. Cases in our area, to your knowledge, are there others who are critical or at least requiring hospitalizations? We were for a while without anyone in the hospital. Everyone was isolating at home. Do you know of any other cases tonight that would be described as hospitalized or critical?
There is one other case that's hospitalized, none that are critical that I'm aware of. As we know, most cases will be mild to moderate, but we know there are people, which is very well illustrated by the case reported by Ballot today of the death, that can be more severe, and even there could be fatalities. But the case that Ballot reported really does illustrate why all of us have to be better at trying to do our best to really decrease community spread and to protect those high-risk people in our community.
Absolutely, absolutely. Something you've been saying for weeks and worth repeating today. So yesterday you were a part of a news conference at City Hall in Johnson City where the city had issued its Safer at Home guidance, and you repeated that plea for people to be vigilant. Today we're hearing about public parks in places like Greenville and Elizabethton now closing. And I think many are trying to wonder, is it safe to go out? You know, is it safe to go to a park? The cities of Elizabethton and Greenville saying parks are closed. What do you want people to know as they're hearing, go out, get fresh air, get sunshine, it's good for you, exercise, but at the same time, public parks closing? What's the message that you want people to hear there?
Yeah, so it's really avoiding crowded places, obviously. So, you know, household units going out together for a walk is, you know, perfect, getting exercise and enjoying some of our spring weather that we've had recently. But obviously gathering at in an outside location is not optimal, you know, to prevent the spread of coronavirus. So I think some people have taken steps where, you know, you're having lots of kids or adults potentially gathering in large numbers. But I think we do encourage people to get out in small household units to take walks and things like that, but just avoid places where obviously there's crowds where you could have more spread of coronavirus.
And the governor even pointing out that playgrounds weren't advisable where there were surfaces yesterday, that was of concern. I want to tell you today, Doc, I saw a number on that state website that made me feel a bit of happiness, and that was the state today reporting for the first time that I can see a number of recovered, 121 recovered statewide. Talk to me about the cases in our area, where we are with those who are recovering and have recovered.
Yeah, so we're following, you know, a number of obviously 30 or more cases currently. We have only one hospitalized person, so most people, we're checking in with them every day. Most people are getting better, which is good news. But I think that the death that was reported by Ballard really illustrates, you know, we can't take it lightly just because most people are getting better, because when it does hit that high-risk population, we could see severe illness or death from coronavirus.
Give us a grade, Doc, here in Northeast Tennessee, Dr. David Kershke, of how we're doing with social distancing. Are you happy? Are you still concerned? Is there more work to do?
Yeah, so, you know, most people I would say are doing the right thing and following guidance for social distancing. But we really need, if you look at modeling, you know, on flattening the curve, we really need a really high level of people complying with social distancing recommendations to really flatten the curve. So, you know, I think we're getting better all the time, you know, between, you know, the mayors, city and county mayors giving orders for social distancing yesterday and today, the governor doing it yesterday. I think all of this is helping public health try to stop the spread of coronavirus.
Dr. David Kershke, one of the real leaders in our region in this pandemic, thank you very much for your time as always. We very much appreciate it, and all the work everyone's doing there at the health office. Thanks so much.
Yeah, thank you.
There is a hotline. It's right there on your screen. It's the number you can call Monday through Friday, 8 to 6, the coronavirus information line at the Northeast Tennessee Regional Health Office. We're back.